rest for our brains. And we're coming back a little bit late. I think getting everyone through lunch took a little bit longer than we expected. But we're very grateful that you are here and have come to join in some discussion on how we make assistive technology more available. So I'm Kylie Shae. I'm the team lead for access to assistive technology at WHO. And with me, I have some panelists who are all very experienced in this sector from different perspectives, and I will introduce them in a moment. I also want to let you know that we had a slightly longer session planned, but we will aim to finish at 3:30 on time, just to help us all catch up with the program. So there'll be a little bit less time for discussion, but we do have a wrap-up session after this, after afternoon tea, where there's still another opportunity for you to ask questions. So don't worry too much if you don't get to say as much as we would have liked you to have been able to say during this session. And I will also add that, we're all here for the duration of the conference and very happy to keep talking with you in the breaks and so on about this topic and to hear your experiences. Really, really valuable. Okay, so I would like to start off this session by just giving you a little bit of a framework for assistive technology, and then we will hear from each of the panelists, as I said. We hopefully will have a little bit of time for a couple of key questions, and then the panelists will share their key takeaways. So thinking about this sort of framing, the first thing I really would like to do is just clarify some terminology, and I don't have any visibility of the slide that's up. Can I just check from tech over there, are you progressing my slides for me? Yes? And I don't have great long distance vision either. I think you said yes. And could you just make sure that the very first slide is there, which shows a few bits of text explaining that assistive products, so that we know what we're talking about, assistive products are those products that maintain or improve a person's function. And they may be a physical product, they could be a digital product. So in terms of physical, we could be talking about glasses, a wheelchair, prosthetic legs, very familiar to this audience, or a hearing aid. There's a broad range. And from the digital side, we could be talking about a smartphone, or a digital screen reader, and any other number of digital assistive products. Now, at the World Health Organization, we use the term assistive technology differently to assistive products. They're not the same thing. Assistive technology encompasses the assistive products, but also the systems and the services that are needed for people to have access to these products. And we have recently estimated in the first World Report on Assistive Technology that there are at least 2.5 billion people who need assistive technology now, today. That is 1 in 3 of us, making access to assistive technology a whole of population issue. It is not a purely disability issue. Can I have the second slide, please? But I do want to put this into the context of assistance for survivors. In this context, I think the sector often thinks about a smaller range of products than I just briefly described, often focused on mobility for obvious reasons. Because yes, injuries from landmines dramatically impact people's mobility, and we require then mobility assistive products such as wheelchairs, prosthetic limbs, walking aids. But there are other impacts, which include hearing loss, vision loss, and issues with mental health, all of which can also be supported through assistive technology. And we also need to think about the fact that survivors' needs will change over their lifetime. They will need ongoing support, and the simple fact of aging or the event of other health conditions can result in new assistive technology needs. So we need an inclusive system for people to be able to access this support. Now, finally, I would just like to offer a framework for thinking about improving access to assistive technology. And Marc alluded to this earlier today. The next slide, please. I think it's gone up. This is the slide showing? Yes, thank you. So you should see here a framework which was developed over a number of years. It's the WHO GATE initiative, and it was developed by over 2,000 people globally, which is which is and these people have a common vision about increasing access to assistive technology for everyone, everywhere. And collectively, the GATE community agree that successful, inclusive, equitable access requires a strategy that takes action across each of these 5 Ps. Firstly, we need to consider the centrality of the person who needs assistive technology. We clearly need quality, affordable, available, and appropriate assistive products. That's our second P. We need provision services with competent personnel, so our third and our fourth Ps, able to support people in the selection and fitting of their products, as well as training in use and follow-up. And then finally, wrapping around all of this, we need supportive policy environment. They are the few key framing points that I wanted to share before I hand over to each of the panelists. And so now, I would like to turn to Kamel Saadi, who is the Director for LifeLine for Rehabilitation in Jordan. So Kamel, from your experience as a landmine survivor and someone who has worked to strengthen provision of assistive technology in Jordan, what are your thoughts about the necessity of ensuring solutions to bridge the gap in assistive technology that are person-centered, that include people with the disability themselves using these products, and ensuring that they are directly engaged in the planning and the implementation of programs to strengthen access? Over to you.
Thank you, Kylie. Hello. Having lost my leg in 1979 at age 14, and I'm 59 right now. So I've been through all kind of prosthetic devices except the wooden leg that was during the pirates. Right now, the technology that we have for prosthetics would just cancel all what's been in the past. But in the past, it was the best. So it doesn't mean that it's bad right now. What we face, and we have to be careful about this industry that we live in. Today, it's very easy for any landmine survivor, any person with different ability, any person who needs assistance would come in and would say, I want the high-end product. I need this, I need that. And it's not really what they need. It's based on the life they are living. There's a specific need that would fit them. And that's where a specialist should be there to decide what is the best for them. And the best for them doesn't mean the most expensive. It doesn't mean the richest producers, without mentioning any names. And it could be the simplest. And this we face every day, and that's where awareness and education fits in.
Case and strategic purchasing. That was a lot in one. And the very last one, I have one more. And lastly, public-private partnerships and strategic investments that increase the pool of partners, as well as close engagement with governments, are essential for long-term impact and sustainability.
Thank you, and they're great key takeaways. So, okay, and then over to you, John, for your final parting message, and again in Spanish.
Yes, of course. Gracias, thank you. Muchas gracias, Kamel, por la fuerza que me has dado. Bueno, como dije, como la pregunta es el desafío que tenemos, primero hay que presentar el desafío y también deberá haber solución. En esta parte yo quiero compartir posible solución que puede tener el fracaso de nuestra sustentabilidad de servicio. Bueno, uno de ellos es igual que tú me dijiste, mejorar la capacidad de recursos humanos. Es una de las, desarrollar un plan laboral para rehabilitación y basado en necesidad del país y hacer que toda la rehabilitación pueda llegar a todas las personas que necesitan. Integrar un plan más amplio para personal sanitario, garantizar que el gobierno disponga de un gama amplio de personal de rehabilitación en todas las instituciones regionales, involucrar usuarios de tecnología o de producto asistido, tecnología asistida, integrarlos y sus familiares junto con la asociación de personas con discapacidad del país y otros para ayudar en cómo sostener el servicio. Otra forma de sostener el servicio, fortalecer o formar la organización de personas con discapacidad para poder hacer proyectos y candidatar a fondos de sociedad civil para que se pueda sostener. Esto es mi key message. Pero gracias.
Thank you very much, John. It's like a roadmap for Guinea-Bissau and other countries. Thank you. Berit, over to you, please, with your key takeaways.
Okay. Take-home message from me. I believe that empowering the personnel working closely with the person in the local community, you reduce the distance between the professionals and the user. You will be able to provide good services like assessment, maintenance, and follow-up of the assistive device on a daily basis. You can't depend on a service located just in the central areas. This will create a system where the user will have to travel for hours or days to get the service they need, and the staff will never have enough capacity to follow up the user and the assistive technology. I therefore believe in the model where the specialist and the generalist cooperate and work hand in hand. Another key message must be refurbishment. As I mentioned, creating a system where the product belongs to the state and are lent to the user, I believe is more sustainable, both considering cost and environmental issues. In this way, it is easier to exchange the product when the person changes, for instance in size or function. You can return the product, making it available to another person, reassured you will get another solution which fulfills your need in a better way. Thank you.
Thank you very much. And now, yes, Marc, can we hear from you?
Yes, sure. Thank you. I fear a little bit that I preach into a choir here. But anyway, I'll try to give you my message. I think one lesson learned from this event here, we should also have, when we say to break silos, we should have more people from Ministries of Health, more people from Ministries of Social Affairs. So that to the breaking silo. Now to the key takeaway message. A national coordination committee body shall clarify who does what, when and where. Identify your needs. This will allow you to elaborate your budget. Work transversal and avoid silos. Assistive technology is an essential element of service provision, but should not be understood isolated. Without the adequate human resources available, the best technology is useless. Thank you.
Very succinct, thank you. And Rebecca, I give you the last words to share and the key messages, so over to you, please.
Thank you, Kylie. I would say that there's always an opportunity to plan towards sustainability, regardless of what level you're working at, if it's within an organization or at the national level, and in acute or post-acute settings. For example, with the AT kits that were provided in Ukraine, we've now had some feedback that they would actually prefer higher quality wheelchairs because a lot of these people are going to be using these wheelchairs long term because that's currently what's available. So always trying to move towards what's going to be sustainable long term. I think the other key takeaway, although I didn't attend the whole conference, is that it's time for implementation. A lot of the solutions are known and more resources are being mobilized to create those sustainable systems at the national level. So really to move this into implementation and start learning what's working is hopefully the phase we're in. Thank you.
Thank you. Thank you very much. Now, it's 28 minutes past, and I promised to deliver us all safely to afternoon tea by 3:30. So I have very little left to say in these last few minutes, other than I really want to thank the conference organisers for creating this space to talk specifically about assistive technology, because it is such a critical issue for landmine survivors. And as you can see, it's a growing issue for many of us in the population. So having the space to talk about this and to think about how we can have integrated services and to hear from this amazing panel from their perspectives, I think is a really valuable opportunity. So thank you to the conference organisers. Thank you to yourselves for listening to what we had to say, and huge thank you to each of the panelists for taking the time to really crystallise their thoughts and deliver them to us in a 5-minute and then a 1 or 2 minute burst of incredible information, well encapsulated. So thank you all very, very much appreciated. Thank you. Apologies that there is no time for questions in this framework. Thank you.